Hi, everybody. Thanks for joining us this afternoon. We are here for the Healthcare Analytics Certificate information session. So thanks so much for joining us. We have folks trickling in as we get started. But we're here to talk about the next classes that are going to be starting in our spring quarter, a little bit about what you can do with a Healthcare Analytics Certificate. And then we have one of our longtime instructors here with us as well, Tom Whitmer, so we'll be speaking with him. So let's get moving. Here's our team. My name is Heather Ogle. I'm your main point of contact throughout the program, answering questions, helping you get your course plan worked out, all of these sorts of things. And as I mentioned, we have Tom with us today, which we're really lucky to have him. He's been with us for, over 5 years, I think. And then we have my teammate as well, Chelsea. She's going to be helping out with polls and the Q&A section. So if you have any questions as we're going along, please use that Q&A box and throw them in there. We'll be answering questions as we go, as they apply to the slides, and then we'll have some time at the end for more questions as well. And then if you have any problem enrolling in classes, or you're curious about funding and these sorts of things, that's going to be our student services team, and their info is up here on the left-hand corner. And this is a good time to let you know this session is being recorded, and you're going to get a link to the recording when we're all done. So don't feel like you have to furiously write things down. You can have this session and pause it as you go through later. And please, with those questions, throw them out here. We're all here for you today. So if you have a question, put it out there. We really just want to make sure that we're getting you the information that you need to make the right decision about the program. Here's our agenda. We're going to talk a little bit about what healthcare data analytics is. There are a few other fields out there that can be confused with healthcare data analytics. So we'll talk about what it is, what it isn't. We'll talk about our certificate, the structure of the classes, and then financing. Everybody always has questions about financing. So to start out, it'd be helpful to know a little bit about you guys. So we're going to run a poll and see what level of experience do you have in data analytics. We get a whole range of folks. We get people who are career changers, haven't really had any experience as a working position in data. And then we have some people who are already in a data analytics position, but they'd like to add this to their resume to really solidify the fact and show employers that they know what they're doing. And then we've got some folks in between. Maybe they've played with computer programming before, done some data work, but really want to move into the healthcare sector, which is a little bit of a specific genre. So let's see who we have here. Okay, excellent. Some solid experience are our biggest part of the folks here today. And then we have a smattering of other folks, beginner, some experience, and a total expert. So perfect. We'll try and make sure that we cover everything that's needed to know for all of those experience levels. But it's nice to see that everybody has a little bit of experience for the most part. And for those beginners, we do have some options for you to dip your toe in and get some exposure without fully committing to the program. So we'll talk about that as well. Thanks for that. So what is healthcare data analytics and what isn't it? So we're here today to speak about the program that looks at collecting, managing, and analyzing data within healthcare databases. All of our medical records, they're all electronic these days. So there's a massive amount of data within the computer systems in hospitals, also in insurance agencies, county health departments, multiple places. There's all this collection of data. And data is not helpful unless we actually look at it. So that's what data analytics is in a healthcare field. You're going in, you're saying, I'd like to know all of this data on this particular topic, but only for this subset of people if they fell on a Thursday. And you pull all that data and run some statistics, and you can tell a story then. And this data is used for hospitals to stay competent with their certification so they can keep providing care. It's so that they can try new things and be like, well, what if we try this? Let's see what happens. Do we get better results? Insurance companies use it to try and see their population and see, okay, what kind of people do we have taking our insurance? What kind of health risks do they have? So a whole range of questions can come up around healthcare and the data. And as a healthcare analyst, you're going to be the one pulling that data and interpreting it and telling the story then to the folks who are asking you those questions. Tom, would you add anything else to the explanation of healthcare analytics? I'm putting you on the spot.
Yeah, hi, good morning, good afternoon, everybody. Tom Whitmer here. You know, I think it's a brave new world out there for analytics. There's just a tremendous amount of opportunity. Heather touched on some of the places where you might find yourself. You might be a clinician as well, and finding yourself as a principal investigator or part of a research project where you're interacting with analytics teams. And, you know, I think the program can help enhance the way that job is done, as well as if you're a hands-on analyst, programmer, researcher, or other type of clinician. All these electronic medical record systems have analytic related components. The government has big requirements for all healthcare providers to do just a whole variety of things. And so depending on where you're coming from, even, you know, just as a pure technologist or with someone with clinical background, and it's evolving. That's personally what interests me, and what's happening here is it's constantly evolving. So if you're challenged and you like that type of work, this program will give you a great overview there.
Great, thanks, Tom. So let's talk a little bit about what a certificate does for you in the market and how it's different from some other things. So in searching for schooling and information on healthcare analytics, you may have come across some online tutorials that are going to be, some of them are free, which is neat, or others are low cost. And those are really, really great if you have a specific question or you're just kind of thinking about looking at the field, but it doesn't get you a full in-depth education. And then on the far end would be a matriculated degree, like a graduate's degree, which is super in-depth, takes a lot of time and a lot of money. So it's very expensive. And then a certificate, like ours, sits right in the middle. So you're getting something, you're getting in-depth education. We will get into the weeds of programming and how you're going to do that, the statistics, these details, so you can actually have the skills to do the job. But the cost is going to be a lot less than an actual degree. And unlike online tutorials, you're going to have an instructor there with you to help you as you go along. Our classes are, they're all online, as most classes are these days. But the lectures are on video, so you can watch those lectures anytime throughout the week that works for you. And then you can connect with your instructor to ask questions and have discussions and clarify things. And this is something that you're just not going to have with the online tutorials. Also, you have the benefit of the UC Davis name. It's a recognized, respected institution. Our classes are approved by the graduate school. So you know that you're getting quality education that other people are going to recognize on your resume as well. So, and then career possibilities, they're pretty vast. This is some smattering of survey from our students over the past. And some of these people were already in these positions when they took the certificate. And some of them let us know that they ended up going to these positions after our certificate. So you can see that it's really, it runs the gamut from public health and government to consulting firms and in-house analysis for large hospitals. So there's really a lot out there. I did a recent search on I think it was Indeed. And there were 20 results that came up in a 2-minute search. 20 results for jobs right now related to healthcare analytics. So it's a good time to be looking into this field. COVID has certainly impacted that. We're looking at data and how to manipulate and understand data in the COVID world. So it's a good time to take a look at this field. Here's some more, just more about our students, where they've gone, what they've done. So you can take a look and see that we've had people who are nurses, physicians, computer programmers, you name it. If you're interested in it, in the topic, you can come and learn and do well. So let's do another poll. Just curious, what are your goals with using the healthcare analytics certificate? Maybe you're already in healthcare and you're looking to get more into the analytics side of things. Maybe you're looking for a promotion. You're already working in quality outcomes or some sort of other analytics department and you want to move up. Or maybe you're just looking to add the formal education to your resume. Or maybe there's some other goal that we haven't talked about here. So let's take a look. Okay, what do we have? Currently in healthcare and looking to get into the healthcare analytics or use analytics more often is by far our biggest winner here. So that's great. You guys are going to have a great background and understanding of the healthcare side of things, the language, how things work within the healthcare field. So that's really going to give you an edge. And then as long as you have some experience with computer programming and analytics, you're going to do really, really well. And like I said before, if you're totally new to the analytics realm, we do have, we call a SAS primer class that can get you introduced into the computer programming part of things. Right. So here are our instructors. They come from a wide range of fields, which is by design. We like to have the variety of perspectives and backgrounds who are going to be your instructors as you move through this program. And we're lucky to have Tom with us today, as he's already helped answer a little bit about what healthcare analytics is. Tom, do you want to speak to a little bit about your background in healthcare analytics?
Sure, I can. I don't know if you can pop my video up, but it's not critical, but that'd be nice just to connect with people a little bit better.
I don't know why your video is not showing.
Yeah, I can't turn it on. But sure, I'll go ahead and get started. So my background is I'm a technologist. I grew up in the technology side of things and was a CIO and a director of IT at a medical center on the East Coast. And then I consulted for about 10 years with insurance companies as well as hospital systems. Primarily, I did a lot of health information exchange, foundation planning to help them come up with their business models when health information exchanges were emerging. I did a few different states across the country. Some of them made it, Delaware, Colorado, West Virginia made it. Some other ones did not make it. And then for 10 years, I worked for Kaiser Permanente, running shared services analytics, and I had corporate IT responsibilities for like corporate research, compliance, legal, and other community benefit, other corporate functions. I have been in the program since 2014. I'm elated to be part of the program actually with these colleagues and the students that we've had. What I like about the program, frankly, is you could be a complete novice, and we do talk about some very in-depth topics, and there was a great care actually given to enabling a novice person getting into the program, because there's a lot of people that might be in human resources or they want to get into healthcare, and they want to upskill themselves. And so the program content can accommodate that, as well as like a senior, I've had plenty of physicians, senior nurses, nurse managers, quality people, people from payer organizations. So that's not frankly very easy to do, and especially with like some programming classes. This is not like a programming certificate program, but we do some special things where we at least give students exposure to things, and we use some code generators and some things like that, so that you can run kind of the spectrum of whether or not you really want a lot of hands-on. That can be accommodated, or you want some exposure because you're working side by side with someone in a healthcare organization, or trying to get into one where you understand the vocabulary, and you can contribute from that side of thing. A lot of times more senior leaders might be in that situation. So that's a little bit about me. I live in Florida right now. I used to live in San Francisco, and that's 2 cents on me.
Thanks, Tom. That's great. I appreciate it. And Tom he instructs 2 of our classes. And one of them is going to be the introductory class that's coming up this spring. And we'll talk a little bit about that in some more detail as we move on here. But he's one of our most beloved instructors. So a little bit about the program structure. It's 5 classes altogether. So you can take those classes 2 at a time if you want. Just depends on your schedule, though. If you are a full-time working professional, you may want to do 1 class at a time. But these days, people are career changers, may not be working full-time, who knows? And if you're in one of those situations, you may want to consider taking 2 classes to speed through a little faster. Totally up to you. We can get together and work out exactly what a schedule might look like. As we talked about before, the course is online, your assignments are online, and everything is done on a weekly schedule. So you have 1 week to work through the readings and the projects, connect with your instructor, and then move forward to the next module in the following week. Okay, and things to look forward to with the assignments. They can be written assignments, they can be coding assignments. In the stats class, there can be some math. That is one prerequisite that we have. You do need to have had an introductory stats class before taking our applied statistics class. And that's just to make sure you're going to hit the ground running and be ready for that class. But you can start the program without having had your stats yet. You just need to make sure you have it done before taking our stats class. Here's our schedule. Most of our classes we run twice a year. We have an exception with one of them. So when you're getting close to needing your final class, you're going to want to be sure to plan ahead and grab that in the spring. But otherwise, these are all 5 classes, and you can basically take 1 class every quarter and be done in 5 quarters. So what to expect? You're going to be doing a lot of manipulation with data, but the instructors also take into consideration your background with data. They provide data sets and samples and examples so that, like Tom just said, we can have people who are very new to working with data and people who are very experienced. The more experienced, if they want to find their own data and run those reports and pull that data, they can do that. And then the people who are really new, they can use something that's already been pulled, and that just makes it a little bit easier to get into the groove of things and understand. So our instructors are great for taking into account where each student is at with their level of understanding as they come into the program. You can see some of the tools that we use. Excel, sure. SQL and SAS are our 2 major programming languages. If you don't have any background with computer programming, we have our SAS primer course, It's separate from the certificate, and it's a shorter, self-paced 7-week class that you can take in the summertime to become more familiarized with just how the languages work and just get some of that background to help feel comfortable in the classes. Tom, would you like to speak a little bit about what the intro class is like?
Sure. The intro class is designed to be just that for the certificate program. And, you know, like every industry, there's a whole lot of unique vocabulary. It looks like, based on the poll here, that majority of people here on this call are already in the healthcare industry. But we're 10 years in now on the Affordable Care Act, and a lot of things have happened since the Affordable Care Act came into play, and also the HITECH Act that enabled a lot of electronic medical records to be put into place, which enabled analytics. So this class was actually designed by a pathologist and also the chief information officer of UC Davis at the time. This was around 2015 time period. And so they provide in the lectures a really nice orientation to how the Affordable Care Act was coming into play, and also taking into account some other topics such as disease registries, electronic medical records, the layout of an analytics team, and improvement methodologies such as Six Sigma and Lean. And then in the last year or so, year and a half, we have updated the class. I started teaching the class about a year and a half ago, and we started to update the class because now there's a fair amount of research that's also available on what's the effectiveness of EHRs. You know, research takes, many years to catch up, but formal research papers, the majority of the reading in this class is formal research papers. There's like 2 or 3 of them provided each week on that complement what's going on with the lectures. And there's a small text, but the text is really about healthcare vocabulary. What's a grouper? What's utilization mean? That it's a 30-page easy, fun read for healthcare terminology and key kind of reports and government reporting. And so so what you get in the intro class is you get a huge exposure to a lot of different topics. And you get kind of what I kind of like to think of as the promise of what the Affordable Care Act and what electronic health records was supposed to provide. And then the research papers, which are, not old, usually we tried to pick them so that they were not older than about 12 to 24 months old. I think there's one in there that's a little bit older, but there's about 30 research papers in total around these topics. They're not very long. And so then the research starts weighing in on not always a counter position, but confirming these were the quality measures that were intended to be achieved. How are we doing in certain disease states and other things? So that's a little bit of the analytics class, or the intro to analytics class. The assignments there are primarily reading and discussion. And then there's a paper project and a exam summary of the lectures. So you write a 5-page paper in analyzing a separate piece of research, which you will select in your area of interest.
All right, thanks, Tom. And then you also teach one of our last classes in the series. You want to do a quick overview of what that class would be like?
Yes, sure. So data mining is the other class that I teach, and I've taught that class since 2014. So I'm going to give a rah-rah to data mining a little bit. Don't be intimidated by data mining. This is a awesome field. It is it can be intimidating. What I do notice is, I like to see people matriculate. Now I'm at the beginning of the program a little bit, and I'm also a little bit more at the end. And so, and I think sometimes people get a little bit intimidated. There's no need to. What we do in data mining is we talk about data mining processes, And those include SAS is an analytics company. They have a process which they've embedded in their software. But we also study CRISP-DM and another methodology by someone named Dorian Pyle, who has a process in the beginning. So from understanding the process, that can be applied to any tools. There are millions of tools and so many awesome things being invented every day about how to do analytics better, whatever stage you might be in, data identification, data cleansing, data preparation, modeling, model assessment, and whether you're, pick a tool, a big data tool or a, Tableau. There's about 25 different data catalogs now on the market or more. There's probably more than 25 BI visualization tools in the market. So we do use Enterprise Miner in this class primarily. And the only reason for Enterprise Miner is because it's a code generator. So you can get through a tiny little piece of programming that I give you some code there to use. And then it uses a graphical user interface where you drag nodes down to a canvas and it generates code behind the scenes so that you don't have to be a programmer to take this class. And this is a non-graded component of that class. The assignments are primarily geared toward asking for data, also observing data. There's a group data mining project, and then there is a little final exam on the lectures. So we're in week 10 of a quarter right now, and we just had the group presentations. It's all this whole program is asynchronous in terms of you use a learning management system, and but in data mining we do have one synchronous meeting where the student groups present their data mining and we look at visualizations and things like that, and what tends to be effective in communication, what tends not to be. And actually that's pretty much, that is the highlight of the class, just like real-time feedback, 15 or so people in multiple groups showing how they interpreted and did the same analysis. So sometimes it sounds a little intimidating coming up front, but it really is the highlight of the course, which actually we just did last Saturday. So.
Fantastic. Thanks, Tom. I think that really gives a good perspective on, where you start and then where we get you to and where you're going to be comfortable as you progress through the program. So let's go ahead and keep going. And this is just the overall idea is that you're going to prepare data, pull it, you're going to analyze it, and then you're going to present it. I mean, that's the big frame overview of data analytics, no matter, whether it's in health or somewhere else. But then you layer over it this specific field of health and makes it interesting. So we've mentioned a couple of these already, just things to make sure that you're ready to succeed. You do need that statistics course. I saw in the chat one question about, if I've had graduate statistics, could I substitute that? And there's a potential for that, but our statistics class isn't just about the math. It also involves using data sets, learning to pull the data sets, and writing the analysis of those sets. So it's not like your standard statistics class. You use those methods in math to analyze things, but it still includes the data world. So if you have something like that, you can always contact us and we can talk about and look at the specifics to see if maybe you could transfer a class or something like that. But just a heads up there that the classes do always involve that data component. And then we have here that, it's recommended to have a background with healthcare and data of some kind. And it sounds like most folks here do have that. And, again, if you don't, we have that SAS primer class in the summertime where you can dip your toes into the SAS language, which is the predominant language in the healthcare field, the predominant database that's used and has been used for a very long time. is SAS. So you can sort of get to know SAS and feel real comfortable with that before starting the program, if that's something you'd like to do. And, just know that these are, graduate level classes. So having had some experience with college classes is highly recommended. These are going to be, you're going to be doing a lot of reading and that kind of stuff, and math as well. So just to make sure that you know that up front. So why UC Davis? Again, this is to the effect a little bit of, why get a certificate and not do online tutorials or that kind of thing. And UC Davis is nice because our professors they're not just instructors who teach all day. They're working professionals. They are actually in the field doing the work. They're up to date on the trends. So they really truly know what they're teaching. And they're excited, they're here to teach because they're excited about it. It's not their main gig. They do it because they want to share the information and the knowledge. So you really get a great instructor out of that kind of situation. We're definitely competitively priced. You can find some fairly pricey courses out there. And then especially if you go for a master's degree, it's going to be a lot more money than the certificate. And we have, again, the instructors come from a lot of different backgrounds. So you're not just getting, government or for-profit, or you're getting a whole variety of perspectives on the field. And that's going to help you figure out where you want to go. Our instructors are happy to speak with you about their experiences and the world of healthcare analytics so that you can use them as a resource to help think about where you'd like to take this degree if you're looking for a career. And then it's nice, you get a digital badge. So everybody's online these days, social media, these sorts of things. You get, this is an example of the UC Davis digital badge for LinkedIn that shows right up front that you are an educated healthcare analytics. You have a healthcare analytics certificate, or you are a healthcare analyst. It's a mouthful. So UC Davis definitely has a lot of great reasons to come and take your education here with us. All right, keep those questions coming in the chat if you have any. We're just about towards the end of our presentation. Financing your education, that's always a question. You're going to register for the certificate. That's $125. And what that does is let us know that you are interested in taking all of the classes and finishing the certificate, so that if anything is updated or schedules are changed or anything happens, we can let you know. We know that you're on our list, you're on our radar. It also gets you access to myself as a counselor for your schedules and these sorts of things. If you're just interested in one class, sometimes there are people who just want a data mining class. Give us a call and we can check on your background and make sure that you're going to be good to go in the class, and you can take just one class. So that's why it's important to do the registration fee for the certificate, so that we know that you're going to do the full range of classes and we can keep up to date with you. The classes are $1,200 a piece. Each class is the same cost, keep it simple. And textbooks and readers, as Tom mentioned, we got rid of one of the textbooks recently out of the intro course and replaced that with up-to-date articles, and have just a very small, cheap textbook as part of that. So there will be a small purchase of a textbook or reader for each course, and you find that out when you register. But if you budget $100 for textbooks each course, you'll be fine. You'll be, you'll have more money left over. And then we do have some discounts if you're a UC alum, or if you're doing a group enrollment. Say you have two other friends at your place of work. If the three of you come, you can get a group discount. And then as far as financing options, we do have some connections with some preferred private loans. We don't qualify for FAFSA, for federal loans, because we are just a certificate and we're not a degree. So don't get ready with your FAFSA and do all that work and then expect to get, be ready for your funding and then find out, oh, I can't use it. You can do student loans, but they're private student loans. Also GI Bill and job training funds like WIOA, these things can also apply if that's the situation that you're coming from. So we had folks in each level of background. So now after getting some info on what the program's like, I'm curious, where are you landing? What are your next steps from here? Maybe you're ready to go. You're like, okay, yep, this is what I am looking for and ready to sign up. Maybe you have a few questions that you want to connect on before you sign up. Or maybe you thought this was something and it's something else. And so this is not the right certificate for you, and that's totally fine. We say right person, right program, because we want to see everybody succeed and get the education that they're looking for. So let's take a look. Here we have. So we have a couple folks sign me up, I'm ready to start. That's fantastic. And then the majority need a little bit of time to think, which is totally fine. We have time. The classes are going to start April 7th, and you can enroll all the way up until that first class. So, keep that in mind. If you enroll ahead of, before that, it helps us out for planning, but you can enroll all the way up until the first day when classes open online on April 7th. So there's still some time to get those questions answered, get your funding wrapped up, and then get enrolled. All right, so do we have any lingering questions that we need to cover? How's it looking, Chelsea?
I think that I have got all the questions answered through chat, but if anyone still has lingering ones, feel free to go ahead and pop them into the chat function and I can answer them or throw them out to Heather. I'm just also putting in there in the chat, I put in there the registration link. So if you want to go in there and get a good peek of the classes or to register for classes, that's in the chat. And then I'm also putting our LinkedIn account in chat as well. And you're welcome to follow us along on LinkedIn, where we announce when classes are ready for registration and we post articles and all those good things.
Thanks, Chelsea. That's awesome. Yeah, Chelsea and I, we post regularly to our social accounts. And so you can keep an eye on that. And then if you're still trying to decide if this is the career for you, you can see what the field looks like on a day-to-day basis.
Oops. Seems like Heather may have just gotten kicked out of the webinar. So I just want to open it back up real quick. Tom, is there anything else that you would like to add while we're here today?
Sorry. First off, thanks for listening today. It's been great talking with everybody. I'm on LinkedIn. You can certainly connect with me as well if you have some specific questions. We have a great cadre of instructors, and the students have been fantastic over the years. And so I hope, I always say this to the students I have, healthcare needs a lot of help in a variety of ways, and data-driven solutions and insights and people that really care about improving healthcare is really kind of at the core of some of the skills that you learn in this program. So nothing more than the pandemic has certainly proven that over the last year and a half. So I hope you got the information that you needed today and can figure out what's best for you.
Perfect. Well, thank you, Tom. We really appreciate you being here and sharing that insight as someone who's been with the program for a long time. And just to echo what Tom and Heather were saying is that this program really is a deep dive into healthcare analytics. It's not a surface level. You're going to do a couple calculations and finish the certificate. So if you're looking to really deep dive and get your hands deep in there with the calculations and the programming and really get in with the analytics and the data, this is a great program for you. So again, in chat, I also put our email. So you're welcome to email. Heather will answer those emails, and she is also willing to set up appointments if you'd prefer to talk one-on-one about the program. And I think that is it for us today. So again, thank you very much. We appreciate you being here. And we'll also be sending out a copy of the recording later on so that you can rewatch parts if you would like to, or to get any information that you potentially have missed. So thank you again, and we look forward to hearing from you in the future.